Hi, this is Dr. Chi. Dr. Chi Vision speaking. Just letting you know that your eyes are special. Your vision is important to God and is important to you. There are no spare eyes, no spare vision. So if you don't know your vision, if you don't keep a healthy vision, just like the scripture says, Matthew chapter 6, verse 22. If your eyes be healthy, your body will be full of light. Hi, Messi Fuya. Messi Fuya, nice to see you. If your eyes are healthy, your body will be full of light. And I'm crazy about eyes. I'm crazy about vision. Therefore, I'm asking, is your eyes healthy? Is your body full of light? Or are you just looking? Can you actually see? Can you actually see? Are you just looking? We talked about the last time that vision isn't just about seeing. It's about knowing how healthy your eyes are. From the external to the internal eyes. Can you see? Can you focus properly? Have you got short-sightedness, long-sightedness, or astigmatism? And if you're over 40, are you in need of glasses and you're wishing it away? It's not going to go away. From the age of 40 and above, you will struggle to see. And that's not a curse. Hello, Sajad 3618. Nice to see you. So when you get to my age, you can't guess my age. Over 40 maybe. But I don't use glasses for a reason. But you might need glasses if you're a certain age. And that doesn't say that kids don't need glasses. Just in case you say, okay, my children have been pretending to need glasses. Glasses isn't just a solution. I had a definition of what healthy vision is about. My definition of vision is seeing clearly without disease. Hello, Sister Lade. Nice to see you. Seeing clearly without disease. But today I'm going to focus on glaucoma. Glaucoma. I've mentioned it just a little bit. But glaucoma is a blinding eye disease. Glaucoma for me, I'm going to sound like a broken record because I hate seeing people go blind. I don't like people going blind. So if you have a mother, a father, living or gone, that had glaucoma or had symptoms, it's about time you see an optometrist. By the way, I must introduce myself. I am an optometrist. I am certified optometrist. I'm a fellow of the American Academy of Optometry, and I'm a dry eye practitioner as well as transformational leadership coach. So I'm not just talking because I'm guessing what I'm saying. I've been trained to look at eyes. So I've been trained to look after your eyes. So glaucoma is not just a disease that you just wake up and wish away. Like some of us who are church people or Muslims and they wish things away. No. Glaucoma causes blindness. And what is glaucoma? Glaucoma has a very important risk factor which we measure, and that is increased eye pressure. So ask me, Dr. Chi, can I actually pick up what increased eye pressure is? No, you cannot see increased eye pressure. One, because when you have glaucoma, you haven't got symptoms except you have angle closure glaucoma. So glaucoma can be described or defined as damage of the optic nerve, damage or defective visual field associated with increased pressure. And I said associated because the increased pressure is only a risk factor. So it's not a major issue in glaucoma. So you could have glaucoma without high pressure. You could have normal tension glaucomas. You could have angle closure, which is associated with high pressure. You could have just open angle glaucoma as well. And you could have what they call ocular hypertension, which is actually an increase in the pressure of your eyes. Glaucoma. Why am I so keen on glaucoma, especially as a person of color? For years in school, we've heard that glaucoma is worse in Africa. Glaucoma affects black people more. Glaucoma affects the people of ethnic origin. So, like every good thing that happens, oh, these white people are picking on us. No, darling. They're not picking on us. There are things that make us more susceptible to disease. 1, age. 2, thinning of your corneas. Your central corneal thickness being below 555 micrometers, which is a measurement for corneal thickness. If your thickness on pachymetry, which is an instrument we use, is reduced below 555, guess what? You stand a risk of glaucoma. 1, I said about age. Age, if you're 40 and above and you're brown colored, you're at risk of glaucoma. 3, if you have a brother, a mother, a father, a sister who is suffering from glaucoma, and that's what we call first degree relatives, you stand the risk of suffering from glaucoma. And then that's for open angles. But how many people actually check? How many people actually bother? For a certain country I know, which I can't mention, most people are diagnosed as glaucoma, but when we check, they're not actually properly classified. So my role today is not for you to get panicky and say, oh, I'm going blind. But my role is, I want to give you an awareness. I want to create an awareness to make you know that the fact your eyes are open doesn't mean you're seeing. And there's one important factor about glaucoma. You can lose your ability to see your visual on the sides, the visual field. You can have a defective visual field, which means if you're in the UK or in any country, especially the UK, if you have visual field defect, you will lose your license. You will lose your license, the ability to get mobile. So do you really want to lose your license? No. Which means if you haven't had a recent sight test and you don't know that you have glaucoma because you don't know if your pressure is high and you don't know if your visual field is going and you don't know if your optic nerve is damaged, come and see me and I'll look after you, because a stitch in time saves 9. When you come early, I'll be able to pick up any problems because I will do some tests and make some diagnosis, and I can refer you early. Then we can save the risk of blindness. You might ask me, what if I already have glaucoma? What if? Early stages is not a death sentence. So there are surgeries that we can refer you to have done, and there are innovations in the field of glaucoma at the moment. But for me, as a brown person, I'm only concerned that a lot of our people of color are not taking up regular tests in order to check their eyes to find out if they've got glaucoma. Question: is there anything I can do to stop myself from having glaucoma? Hello, Chris B, and hello, Bishop. Nice to see you, sir. Is there any food I can take? Is there anything I can do? I could have naturally said to you, stop being black or stop being an Asian. I'm focusing on black ethnics who have glaucoma. We can't change that, but we can prevent, because prevention is and preservation will secure your eyes. So at this stage, the best thing is get your eyes checked. Check your pedigree. Ask your mom, ask your dad, ask your daddy, ask your brother and your sister. Sometimes they might not know because our ancestors, our aunties and uncles may never have known. So you might find that in certain families, people have been blind. Oh, uncle was blind, auntie was blind, but you don't know why. Then get checked. You might not know that things like that exist in family lines. You might ask me, what are the causes of glaucoma? What else, apart from the risk factors, do you know that taking steroid tablets can give secondary impacts and cause glaucoma? Steroid. And this focus is on women who use certain creams, eye gels, body creams, yes, body creams with steroid in it. You know, steroid in it. So people who use certain body creams and steroids. And when you have such people, you know, using certain creams and body creams, guess what happens? It increases your eye pressure. It could lead to cataract. So, check your eye gels. Check your body cream, especially the whitening creams. Yeah. Some people use whitening creams to get fairer. They could have steroid in it. And if they've got steroid in it, guess what you're doing to yourself? You're increasing your risk of glaucoma. Some people may have fights or punch, you hit your head on a table or somebody hits you in error. Traumas can increase your risk of glaucoma. So there are lots of things that can cause glaucoma. I'm not here to tell you where the opticians are, but if you're in Nigeria, there are lots of opticians you can go and see, optometrists you can see. In the UK, there are lots. But just in case you're still not sure, and since you're on Instagram, there's a click on my bio. There's a link on my bio where I can have a chat if you want to have a chat, and we can talk about glaucoma. I don't want to burden you with technicalities, but again, children can have glaucoma. Yes, newborns can have glaucoma. Little kids who are innocent, you notice their eyes are a bit larger than normal, what we call megacornea. They can have glaucoma. And those kids, if you don't look after them on time, guess what? They will go blind. So the test of children's eye is as important as adults. Glaucoma cannot be corrected with glasses. Just in case you've been told. Glaucoma cannot be wished away and prayed away. Yes, God answers prayers. God heals our eyes and all that. I'm up for that. But sometimes you need to be guided. You need to come and let's see so that we know where to focus our prayers on. Glaucoma, there are surgical interventions. I can't tell you all I'm avoiding telling you technicalities, but there are surgical interventions. There are medical interventions. But above all, there is also counseling. And then what if you got to the stage where the vision is really gone and your vision, you don't know what else to do, and you've lost your peripheral field, you can't see? What else? We've got options. We can rehabilitate you as well. So that we can talk about in case you have family members who have such issues. So children can have glaucoma. Adults can have glaucoma. And then finally, what happens if I meet somebody to get married to somebody and you find out you have glaucoma or he hasn't got glaucoma? I'm not going to sit here. I'm not a marriage expert or relationship expert. But I can tell you free of charge that if you get married to somebody who has glaucoma, you're going to put yourself at risk of glaucoma. Just like you do checks for AIDS and all sorts. glaucoma should be checked, because the risk of glaucoma and blindness is so high when you're first degree relatives. So the person you're married is not the one who is going to suffer the glaucoma, but the offsprings will suffer glaucoma or be at risk of glaucoma. So it's something to think about. So, but it's hard to think about, because when you fall in love, you don't think about all these things. But it's very important factor to consider. And then finally, people ask me questions. I took some eye drops, but it doesn't work. You've got glaucoma already and you're taking eye drops. Please go back to your consultant. Don't go to the native doctor who will give you some strange potions to put in your eyes, because it's not going to help. It's going to make things worse. Again, for children, I'm going to wrap up now with kids. Children's eyes are important. Whether it's about focusing issues or about having to check for diseases or about checking for squints, you need an optometrist. You need an optometrist to look after them. Because when your child starts having poor vision as a baby, sometimes it's difficult to correct when they get older. So today, I was just coming out again to discuss vision, reassuring you that nothing is impossible. Glaucoma is treatable, but it can be picked up early, and then your eyes can be saved if you bring them in on time. So, a healthy mind, healthy body is healthy vision. Take care. Any questions, you can write me a text on the comment if you want to ask questions. Otherwise, thank you for listening to me, Bishop. Thank you, Chris B. Thank you, Lade Sisterly. Thank you, Sajad. Thank you, Mercy Ofuya. It was lovely having you as my guest, and do have a lovely day. God bless you. Look after your eyes. You've got no spares. Bye.